Hi everyone, welcome to Szenan-Balance Live. I'm Szenan from Szenan-Balance, the acupuncturist. Now today our topic is about male infertility treatment. Okay, I'm still waiting for YouTube Live, my clinic one. Okay, it's up now. Hi everyone, if you're here, please say hi to me and give me a thumbs up. I'm Szenan-Balance from Szenan-Balance, fertility acupuncturist. Today our topic is male infertility treatment. Part 1. The part 1 is talking about Western medicine treatment. Then the part 2 is actually talking about acupuncture treatment, Chinese medicine treatment. Then if you're a practitioner, I'm going to show you some strategies, some acupuncture point for you. Okay. Then we're going to move to the next one. The next day will be female infertility acupressure point. What can you do for yourself and for acupressure point at home as female? Then we'll move to male infertility acupressure point at home. So what can you do as a male that some acupressure point can help you? Okay, that's all for patient, but of course it's good for practitioner as well, because you can learn that and give you some idea that you can show your patient how to do that. Okay. Hi, Inka. Thank you for joining us. Thank you. And give me a thumbs up, please. Hi, happy day. Hi, good morning, Veronica. Thank you for giving us your experience, knowledge, and variable time each day. Thank you very much. Good morning, happy day. Thank you for joining us. And yes, first thing, please give a thumbs up and say hello to me. That's the first thing that you do. When you come to my live video, and please share on your Facebook and on YouTube. When you finish, please take the link and share on your social media. Thank you very, very much for your support. Right, let's get into the topic. Our topic is about male infertility treatment, right? We talk about Western medicine, how it can treat, right? Now, it all depends with the cause of infertility, right? What sort of treatment will suit the male infertility? We don't know until you got a diagnose. If there's no diagnosis, there's no treatment, right? We keep saying that. And how long you've been trying, how old are you? Right, your age, and not just deciding the treatment that for male infertility. What if the problem is not just in male, right? It's in female and male both. Then when it's in both, then you want to do you want to decide the treatment that at the same time for the male as well as for female. So those are both important. And it comes to the overall health as well. Is the male currently under any treatment? Like, you probably didn't know that the high blood pressure pill, high cholesterol pill, or blood sugar pill, they actually will make you become erectile dysfunction. And that's so important. That's so important. Not straight away. Some people get it very quick, and some people that actually on those pills for those drugs medication for a while. Then over the year, it developed to erectile dysfunction issues. So when you are trying to have baby, trying to conceive, and how could you have a baby if you have erectile dysfunction, right? So that is important though. So overall health is very, very important. So again, we have been successfully helping patients to reduce medication, right? What's a medication? The most common one, right? High blood pressure, high cholesterol, high blood sugar, right? Or heart disease medication, you know, those medication for arthritis, you know, all this medication, it actually impact in fertility. So if you're on those medication, you want to check on whether your sperm quality is not good. It's actually related to those medication. Okay, so it's very important when it comes to fertility that a lot of information. It's not just you're an acupuncturist or you're fertility acupuncture and you're Chinese herbalist and you just do your herbs or acupuncture and being blind and not seeing other things. You know, it's important to know everything and to find out the real reason behind that causing the infertility for male. If you figure it out more and more and more, then you know how to deal with it. So you need to have a whole picture, not just relying on the report of blood test, the hormone one, or the X-ray, or this thing. Okay, so now or a sperm test. Not just that. Everything comes with a reason. If you're abnormal, there must be a reason of that. Okay, and when you give treatment of acupuncture in Chinese medicine, you also want them to change their lifestyle. Because changing lifestyle is very, very important, right? And directly impact with overall health and as well as fertility issues. Okay. Of course, it comes with the when it comes to treatment, whether it's a male infertility treatment or female infertility treatment, personal preference of you and your partner, and following and the consultation about your treatment option is important too. Because everyone have the right to choose what they want. Okay, I shared my experience last night Chinese platform of my live video. I said about this is how I turn a patient for pain relief patient to internal disease patient giving herbs. And if you're patient, if you come to us, I'll ask you this question if you watch this video on our Facebook and YouTube channel. Okay. Now, if you are practitioner, then you know how you're gonna turn your patient into how do you turn your patient and giving your information to your patient to let them know that you can treat more than just pain. Okay, the patient came to you already, or more than just pain, right? And or you can treat anxiety or depression with Chinese herbs and acupuncture, or with Chinese herbs or acupuncture. The patient don't know, especially when it comes to the European country in the Western world, because they don't know about acupuncture. Acupuncture is new to a lot of people. Yeah, Some people recognize acupuncture. They know they've tried many years. The mother do it, the family do it, friends does it, and they know acupuncture. What can acupuncture do? But they don't know about acupuncture can do for high blood pressure, diabetes, depression, anxiety, digestive problem. Then who's the best person to tell them? You are the best person if you're an acupuncturist. Of course, our business actually rely on word of mouth to get patient out, and we actually ask our patient, will they be able to help us to hand some little note to the family and let them know how acupuncture works. They're happy to do that, so we ask for it. Veronica said, "You will not be disappointed with our work when we treat the patient." Thank you. Now, this is how I do it. The patient come in, they fill in a form, very detailed form, and I 2 weeks ago I asked my patient, one of the patient, this is a real case, and he came in for back pain, very severe back pain, and I said, "Wow, you have diabetes. Are you on medication?" "Yes." He said, "Metformin." "Yes." "Okay, I know it. And how are you controlling your blood sugar? Are they under control?" I said, "No, all over the place." "Okay, all right. Now, I just want to know that I help a lot. Our clinic help a lot of patients to reduce reduce blood sugar medication. In the end, we work slowly, and then we stop the blood sugar medication, diabetes medication. And is it what you want? I asked it. And the patient didn't know we can treat that. They said, "Yeah, I want it because I try to control my blood sugar, and now it's all over the place." And that happened to a lot of people. And he actually lists out 4 medication, and I checked for medication of the side effects, as I always tell you. I said, "Well, you have some symptoms actually come from the related to the medication." Then I asked some dizziness, chest pain, nausea. Ever since he started one particular medication, and he came in, and he actually went back to the doctor and said, "Well, I took this, and you said it's going to protect my heart, but I actually got those symptoms." And you know what his GP told him? "Well, keep taking it. You get used to it. If you don't take it, you're in a risk of heart problem." That's what happened, and he kept taking it. I said, "No, that's not good. You shouldn't take it because this is side effect. You have to go back to your doctor again. This is my suggestion." And we start treatment, and patient agree with that term of stopping medication slowly, and I give herbs and acupuncture. And last week he came back. He showed me the reading of blood sugar. It was over 10 every day, 11 up to 16, 10.5, 10.8, 16.7, 16.8 every day, he said. When he start my Chinese herbs, what happened? It dropped down to 8.6. The best one is 6.7 so far. Under 6 normal. But I said, "Wow, now we need to collect all this data, and you need to give back to your doctor, and when stable, then you cut down your medication." You know what he said? "I stopped all the medication already, 4 of them." I said, "You shouldn't do that." I said, "I just don't care." That's what he said. "I just don't care." I said, "Well, this is not very good. If any trouble with you, and will fail our treatment." So I always tell my patient that they keep taking the medication, and with my herbs, then they go back to the doctor, GP, to get advice of how to slowly cut down the medication. Does it make sense? So this is how you pass the information to your patient to let them know that you can help them with diabetes, heart disease, digestion problem, depression, anxiety when they come for pain, because pain condition, everyone recognize that. Okay, so the reason I want to tell you this, because in male infertility, most of them, they develop erectile dysfunction with medication. So if you don't know about this and you keep treating them with acupuncture, with Chinese herbs, you may find no results. You may have little result and couldn't get to the end. It actually related to male infertility. So in my point is, if they haven't got any erectile dysfunction, and that's okay. If they have erectile dysfunction, then you want to work toward to decrease the medication and improve the organs such as kidney, bladder, and liver, gallbladder. Those are the most common organs that causing erectile dysfunction. Does it make sense to you? So it comes to case by case. You don't know what causing them, and you have to ask all those questions and to figure out what is the best treatment. So it's not just simple, when it comes to fertility. So what I just shared, it means that male fertility can be treated in a variety of ways, right? Depending on the cause, totally depending on the cause. The treatment option for men can include, medication, right? It can be surgery. It can be assisted reproductive technology, the IVF. Let's keep going. What about surgery? What can surgery fix for male infertility? Now, surgery can help obstruction that are preventing sperm from being present in the ejaculate. It can also correct conditions such as varicocele, which is the vein enlarged around the testicle. That surgery can help. That surgery certainly can help. Okay. In cases sperm can be retrieved directly from the testicle, after which it can be used in ART treatment, which means for IVF. Like if the patient have cancer, now you want to treat the cancer because cancer may take the life of the patient depending on what stage of cancer, right? And they are discussing about getting chemotherapy. And the chemotherapy is so harmful. Well, chemotherapy not just for harmful for the treating the cancer cell. It's harmful for any good cell in your body, that including sperm. It will kill your sperm, certainly. So if the man is young and they haven't had any kids yet, then before the treatment of chemotherapy, they consider, and most of them, they will say, well, yes, let's get a needle, go to the testicle and get the sperm out, and get woman's, the wife's eggs and put it together, become embryo. and become frozen embryo, and just save it for the future for IVF. So because you want to treat the cancer, right? And no one can tell you that chemotherapy will fix it, or acupuncture can fix the cancer, or Chinese medicine can fix the cancer. So the way that I do agree with that too, get the sperm out. If you want a baby, get the sperm out first before chemo, before radiation, then store it. Then you do go ahead for your chemotherapy or radiation. Does it make sense to you? Yeah. So it's all depend on what kind of disease that you suffer from and lead to man infertility. Yeah. So I do have patients who suffer from cancer and did that. Okay, and I do agree with that. I do agree with that because I don't think my acupuncture or Chinese will guarantee treat the cancer. Does that make sense? Okay. Now, what about medication? What can medication help? So medication can use to treat issues such as hormone imbalance. So now we talk about you have the sperm test. You have the sperm test and find everything's fine, or the sperm test was not good, and then since the treatment with the acupuncture, Chinese herb treatment, or they have no treatment at all, and everything's fine, or there's always dysfunction, something wrong in the sperm, then further on you need to test out is the hormone, the male hormone. That's important too. Okay, then you can consider about some medication for it, but to be honest, in this part, we use acupuncture and Chinese herbs as well to help with the hormone issues and men infertility. Yes, you can do that. Okay, because what I'm concerned about is you're putting more medication for the men, and all the hormone, it has a problem with what? Side effects. So we can do a natural way, then do it a natural way. If you do a natural way, you get the hormone balance again, then it would help a lot. It would help a lot with overall health, and the sperm quality will be better too. Okay. Medication can also use to treat the ED. ED, what's ED? ED is erectile dysfunction. It can also treat the infection. If that is infection, yeah, go for it. Now again, with ED, some people rely on medication to get erection and then to have sex and then have to try to conceive, right? There's a way, and we always know that erection problem lead to stress, kidney function according to Chinese medicine, or liver, and medication. So you really want to know where that you come from, and then go and balance and get rid of the cause of the erection issues. Then you're back to normal. You see what I mean? So you see what we just mentioned, all this, and nothing to do with sperm quality. the speed. Why is that? Because there is no such a good treatment to increase in the Western side. There is no such treatment to increase sperm quality, the volume, the sperm counts. There is no drugs for it. Morphology, there is no sperm morphology. There is no treatment for it. You see what I mean? There is no treatment for it. There is no treatment or medication in Western doctor that it can increase the sperm count, the semen volume. Drink water can certainly help with volume, you know. And sperm count, morphology, mobility, none of this could help with Western medication. Did you realize that? You probably didn't realize that. They give you a proper test and they tell you all this thing, but there is no solution. The only solution is IVF. You see, they're not trying to correct the issues. But for Chinese medicine and acupuncturists, we can help with that. Definitely, certainly, with our acupuncture and Chinese medicine. And we ask patients to change their lifestyle because we believe that the lifestyle, a cell phone, do not put a cell phone in the pocket. We believe all these things are the cause. If you change this for what you're eating, your stress level, then your semen, your sperm count will increase. The sperm mobility will be better. Morphology will change, will be better too. Does it make sense to you? Yeah. So next time, tomorrow morning, we're gonna talk about acupuncture strategy for male infertility. Now, this is what I just letting you know. It's not a very complete and very talking a lot of medication and things like that. It's just letting you know what Western medicine can do. And to be honest, you have to go to an infertility doctor because it's a general doctor and they don't know much about treatment for male. Okay, they don't know much about it at all. So if you suffer from this problem, you want to see a infertility doctor and expert. But to be honest, when it comes to main things, I do agree with the if you have a cancer, suffer from cancer, and you do IVF, and I do agree with if there is a DNA issues, then they can pick which sperm have good DNA that won't pass any disease to the next generation. And I do agree with that because you're trying to do a prevention for that. But any other disease in men, then I would say acupuncture and Chinese medicine and change of, listen, not just acupuncture or not just Chinese medicine. If you're a practitioner, you can do acupuncture without herbs. If you don't herb, doesn't matter. Just do acupuncture, it still work. Acupuncture and all Chinese medicines and what? It's not all though. And lifestyle change. We're talking about dietary change. We're talking about stress management, emotional daily practice. Then plus what? Exercise. Some people don't exercise at all. And plus what? Apart from exercise, then there's others. That means that we can, as acupuncturists, we can provide you some acupressure point. Then you can work on. Okay, does it make sense to you? That's it for today, and we'll see you tomorrow. Yeah, it makes sense, right? Thank you. Thank you, Marika. Okay, if it makes sense to you, please let me know it makes sense. Hi, Amida, how are you? Hi, Anita, how are you? Share and give me a thumbs up and share this video on your Facebook page if you are on Facebook, and tag your friend into this live video as well. All right, stay awesome, and thank you very much. And I love you all. I'll see you tomorrow. Thank you. Bye-bye. Okay, one daily acupuncture and lifestyle without Chinese. Yeah. You can do daily acupuncture, or when I do just acupuncture, we do it 3 times weekly or 2 times weekly. Doesn't have to be daily. Yep, that's a good strategy. You know, without herbs, yeah, you can do just lifestyle and acupuncture. And lifestyle is a big thing. I never suggest my patients just do acupuncture. Always come with lifestyle change. You can figure out a lot of things that they actually than lifestyle, especially eating, stress, in eating, both that impact with infertility either in female and male. A lot of percent, very high. If they get the stress management better, the eating better, you see the whole life change. They feel much better. Eating the right food is very important. Okay. Yep. I have friend, colleague, they just do acupuncture, they don't add anything of herbs, and they still help a lot of patients. Yeah. With my treatment, I only go for fertility, 1 acupuncture weekly, and with herbs. So because I do herbs, so I can do just 1 acupuncture weekly. For you, if you don't do herbs, Chinese herbs, do more acupuncture, 2 times or 3 times, at least 2 acupuncture weekly. So the effect of acupuncture is cumulatively, right? So you want to build up the acupuncture, consistent acupuncture, and good enough stimulation weekly to be able to help your patient. Does that make sense? All right. Thank you very much. Bye bye again.